Good afternoon, everyone. Welcome back to this next session after lunch. This is entitled The Role of Endoscopy in Cholangiocarcinoma. So we're going to be looking at the diagnostic precision and therapeutic strategies in treatment of cholangiocarcinoma. We have an excellent faculty, all of which I think have been introduced from this morning's session. So without further ado, we're going to move on. So the objectives are these: to understand the role of endoscopy in the diagnostic algorithm of cholangiocarcinoma, identify tissue acquisition techniques and their application, evaluate the use of ERCP and EUS in therapeutic management of cholangiocarcinoma, apply strategies for biliary drainage and adjunctive therapies in clinical practice, define the rationale behind stenting in malignant hilar strictures. Sorry, I beg your pardon. Which of the following is a key therapeutic role of endoscopy in cholangiocarcinoma? So this is the quiz question. Drainage in surgical candidates without jaundice. I'm going to have to look to my faculty to explain the word tutoring. So duct tutoring after extensive intraductal tissue sampling. C, when the surgical plan is not defined. D, in all potential candidates for liver transplant. And then E, mass-forming intrahepatic cholangiocarcinoma. Can anyone give me a definition of tutoring?
So when, for example, you have a massive, you have like to sample large sampling of the lesion.
Yes.
So when you have like to prevent the occlusion by the clot and bleeding.
Yes. Okay, got you.
So it's insertion.
Yes. Okay. Okay. Perfect. Okay. I think without further ado, we are ready to go. So I'm going to introduce now Professor Mariana Arvani-Taki, who is going to talk about the role of endoscopy in the diagnostic algorithm of cholangiocarcinoma. Thank you.
Thank you very much, Raymond, for this kind introduction, and also for pronouncing my name correctly, because it's not always the key point. So I would like mostly to focus on the diagnostic part and what can endoscopy do for us, but also what we usually do, how we're supposed to proceed. So just to remind that we are dealing with tumors that can give strictures in distal part. So this is intrapancreatic bile duct or in the proximal perihilar part. And this is important because the workup is going to be slightly different for these two different locations. I'll start with a case that we had many years ago. So 51-year-old man, he comes in with jaundice. He has high bilirubin levels. He has lost weight. He was in previous good health before. We see that he has a normal tumor marker. And in the US, we see that there's a dilated gallbladder and intrahepatic duct dilation, and the gallbladder has stones. And he has an